Polycystic Ovary Syndrome, or PCOS, affects around 27% of women during their childbearing years. It is a condition in which ovaries produce an abnormal amount of male sex hormone called androgen that is usually present in women in small amounts. The name PCOS describes the numerous small fluid-filled sacs developed inside the ovaries. Usually, ovaries release a mature egg to be fertilized by a male sperm each month, and this process is called ovulation. In some instances, a woman does not make enough of the hormones needed to ovulate. As a result, ovulation does not occur, and the ovaries can develop many small cysts. These cysts make extra male hormones which disrupt the menstrual cycle, so women with PCOS get fewer periods than usual. In today's video, we will discuss some of the most common signs and symptoms of PCOS. Stay with us until the end, because there is one sign that females usually ignore. Number 1. Menstrual irregularity. In women with PCOS, the period might be irregular or stop altogether. The average menstrual cycle is 28 days with one ovulation, but the cycle range between 21 and 35 days is also considered normal. Females with PCOS have high levels of androgen and insulin, disrupting the monthly ovulation cycle and menstruation. Due to the increase in the length of menstrual cycles, ovulation can occur occasionally or stop entirely. Number 2. Excess hair. Excess hair growth, or hirsutism on the body and face, is due to abnormal amounts of androgens, which stimulate the hair follicles. The hair growth is typically in the areas that are usually for men to grow hair, like the chin, lower abdomen, around the nipple, chest, thighs, and sideburn region. It is estimated that around 60% of the women with PCOS have hirsutism. Women with PCOS from ethnic groups like India, Sri Lanka, and Mediterranean populations are usually severely affected by hirsutism. Number 3. Hair loss. Hair loss or alopecia affects some women with PCOS. However, the pattern is usually different from what is seen in male pattern hair loss. In males, the pattern usually starts in the front of the head and gradually recedes to the back, whereas in females, the thinning will start mid-scale and gradually spread in a circular pattern. Number 4. Skin conditions. High androgen level increase oil glands production on the skin, which can lead to increased acne. Although acne is common in young adults, women with PCOS tend to have more severe acne. These women can also develop skin tags, which are soft, skin-colored growths that hang from the skin and typically occur on the neck or armpits. Dark skin that feels like velvet can also develop in women with PCOS. Number 5. Reduced fertility. In women with PCOS, high levels of androgen and insulin can affect the menstrual cycle and prevent the release of a mature egg from the ovary. Ovulation can be irregular or stop completely. This can make it more difficult for women with PCOS to become pregnant naturally. However, this does not mean that all women with PCOS are infertile. PCOS also increases the risk of pregnancy complications in pregnant women. Number 6. Depression and anxiety. Another common symptom of PCOS is depression and anxiety. Coping with severe acne, weight changes, hirsutism, and fertility problems can affect your body image, femininity, self-esteem, and sexuality. This can add to depression and anxiety levels. Fertility problems can impact your mood, especially if you have been trying to get pregnant for a long time. Furthermore, these emotional challenges can be particularly difficult if you are unaware that you have PCOS. A delayed diagnosis of PCOS and problems with weight management can make you feel helpless and discouraged. Remember, this video is for educational purposes. We are not giving you medical advice. You should always consult your doctor if you need any professional opinion. Do you find this video helpful? If yes, then make sure to like this video, subscribe to our channel, and hit the bell notification button.